Hi there, my name is June. Today I'm going to show you a demonstration of catheterization of a male using the principles of sterile technique. Sterile technique in aseptic practices maintain an area that is free from pathogenic organisms. It separates a sterile field environment from an unsterile environment, and it minimizes the patient exposure to infection-causing agents, thereby reducing the patient's risk. Anything we can do to promote health and prevent infection for our patient is a strategy that nurses hold dear. So sterile technique is one of those ways. And so for starters, I'm going to check the doctor's order for all of the specifics associated with this catheter insertion for our male patient, Jesse. And so I want to know the type and size, perhaps, and how long he or she wants it to be inserted, and so on. So I'm going to make sure I have a doctor's order. And then I'm going to check the patient's chart. I want to see if Jesse has any allergies to latex, for example, because most of our standard or typical catheters are latex. And so if Jesse had an allergy to latex, I'd have to use a silicone catheter. And I would want to see why Jesse needs a catheter inserted. Maybe I'm just reinserting a new one. Maybe this is maybe there's problems associated with Jesse's health right now and he needs one. I want to know why. So when I'm happy with all of that information and I've assessed all that I can from the chart and the doctor's order, now I'm ready to go and visit my patient and find out and have a conversation about this procedure. So as I enter my patient's room, I do hand hygiene in front of my patient. That is so important. And then I'm going to identify myself and say, hi, my name is June and I'm going to be your nurse today. And I want you to envision that there is a whole body here, a head and arms and legs, and not just some genitalia for us to insert a catheter. So I'm going to ask Jesse to please tell me his full name and his date of birth. And when he repeats that back to me, I'm going to confirm that by looking at the name band on the patient's wrist. It's absolutely essential that you identify your patient. When I've done that, then I'm going to have a conversation with Jesse. I'm going to explain that the doctor has ordered a catheter to be inserted. Find out how Jesse feels about that, if he's ever had a catheter inserted before, what to expect, answer any questions that he may have. I'm sure most patients, when they have to have a catheter inserted, are quite nervous and sometimes fearful. They're afraid of pain. They're afraid of being embarrassed. It's not a pleasant experience, and so we must maintain their dignity and privacy as much as possible. That's all important. So when I've finished explaining everything to Jesse and Jesse is consented, he's either said yes, let's do that, or no, let's not do that, I'm going to go gather my equipment. So I've gone and I've gathered my equipment and I'm re-entering the room and I'm starting to set up my station now. And so you can see I have this bedside table, so we're going to start applying our principles. I'm going to raise that bedside table to be above my waist so that I'm maintaining the first or the most important principles. Anything that is below the waist is considered unsterile or contaminated. And then I look to my bed and I can see that it's not congruent with the height of my table, so I'm going to go ahead and raise my bed up nice and high. Some procedures that we're doing when we're using sterile technique or not using sterile technique are about good body mechanics. So this has, two reasons for us raising everything up nice and high. We don't want to be bent over when we're providing care for our patients. So I've got everything nice and close, and then you can see that I've created this triangle of success that you hear me keep talking about. We care for our patient from the right-hand side of the patient. So even if you're a left-handed person, as you've heard me say in some of the other videos, you can still do this. If you are a left-handed person, you can still insert a catheter with your right hand. I will show you how you can do that when we get practicing in the lab. And so I've got a table behind me. That's important too to my triangle, because as I'm done with items, I'm going to move them behind me. And I want to be able to move them behind me once my sterile field is open, so that I'm never taking my eyes off of my sterile field, which is another one of the principles of sterile technique. We mustn't ever take our vision off of our sterile tray. So I'm going to, as I said, provide privacy, close the door and close the curtain, and I'm only going to expose the area that I need to expose. Before I do that, I'm going to try and set up everything that I can so that I help Jesse stay covered as long as possible. So Again, in sterile technique, you'll hear me talk about the turning a cuff down on your paper bag. It's because we don't want it to close in on us when we are dropping soiled things that could have infection and bacteria on them. So we want to maintain that sterile bag or that cuff being open. So I've got a couple of pieces of tape, and again, just like I explained in the insertion of a female catheter, that the placement of my bag is very important because I don't want to be reaching across my body to drop the contaminated cotton balls in or my garbage in. I want to be reaching above myself. So I'm going to put my little paper garbage bag pretty much between Jessie's hip and knee, just to my right hip. The next thing I'm going to do is I'm going to attach the urine collection bag. This has to be attached to the bed frame, not the bed rail. So I'm just going to find a hole, and I found a hole right here on the bed frame, close pretty much in the same area, directly across from the patient's hip area. And then the tubing on top is just going to coil in front of me, and that's going to be very convenient for me to grab when I'm done inserting the catheter and I need to attach this tubing to the catheter for the urine to come from the catheter into this tubing. You can see it has a cap on the end. Underneath that cap is sterile. Only sterile can touch that sterile cap. And so when we have our catheter inserted, there's a lumen at the end that is sterile as well that the urine flows out of. That's going to attach there. So we're very protective of those two ends. I'm going to put that cover back on. I'm going to set that right here. Okay. So the next thing I'm going to do is start to, I'm ready to start to do my procedure. So I'm going to expose just the area that I need to. I'm going to apply a pair of clean gloves, and then I'm going to perform pericare on my patient. It's very important that we remove as much of the microbes that are on the genitalia as possible. That reduces the risk for infection when we're inserting a catheter. So we always wash, bring a nice bowl of warm water, some soap, wash, rinse, and dry the genitalia really well before you begin your procedure. So once I've done that, I can put that behind me. I can take off my gloves, and I'm going to perform hand hygiene as soon as I remove my gloves. So I have all my supplies assembled. I don't need this tape anymore. I can put that behind me too. And I'm ready to open up my tray. Normally this would move a lot more quickly, but because we're going through this step by step, it's probably going to be a little longer. So the first thing I'm going to do is make sure that my tray has no punctures or tears or watermarks, that the expiry is good. I'm looking on the bottom, looking all around it, and making sure that it's safe. When I'm sure that it's safe, then I'm going to go ahead and start opening up my drapes. And so I'm going to pull the tape down, and again, this procedure never changes. The first drape is away, and then side, and side. And right away, I'm looking to see the end of this bedside table, because when I'm done, I want to be able to apply my gloves and that packaging not overlap onto the blue packaging. So as soon as I start looking at my tray, be aware of what's happening at this end too, and start to manipulate your tray accordingly so that you're opening up lots of nice space there. You can see I'm moving things around. You can move your table around. And then lastly, I'm going to grab my last drape. You can see that little point sticking up, and I'm going to grab it, pull it towards me, but I'm taking a step back. I never want to be too close to my tray and end up contaminating something with my uniform. So remember what we talked about in our principles. The drapes that fall down below the table are no longer sterile, so you can move those out of your way. If it's covering your garbage bag, move it out of the way. Move those out of the way. It's not sterile there anymore. So now we're going to look at the inside drape. We have our, excuse me, we have our tool here that we can use. I'm going to pick this up now. So now I have an unsterile end, and I have a sterile end. And I have a sterile border, field inside, sorry, and I have a 1-inch unsterile border all running along all the outside of my tray. So if I have to set my tool down, I'm going to make sure that I set the sterile part down well within the sterile field and the unsterile part outside, well outside in the unsterile field. Sterile can touch sterile, unsterile can only touch unsterile. So when I pick this back up, I'm going to open up this second set of drapes now. And the first drape again is always away. Okay? Next drape is towards me. If we look inside quickly, we can see what we have there. I have a large emesis basin to the left. This is the one we're going to use to insert our catheter. I have sterile muco in there that I'm going to open up after I have my sterile gloves on, and I'm going to dollop right here in the corner. I have a smaller emesis basin right here. If the physician ordered a sterile specimen to be taken, that would be the basin that I would use. I have a set of drapes, 2 of them, to create a second sterile field over here under my genitalia. Once I have everything set up here, I'm going to move that to the side, but well within my sterile field. So important that you don't let anything come outside into that 1-inch unsterile border. So you can see that snugged in there and it's safe. You can see I have a third bowl inside here with my cotton balls. And you can see this smaller sterile bowl, that's for my sterile water. So my cleansing solution will cover the cotton balls, and I need 10 mils of sterile water in this procedure to inflate my balloon. And then I have a pair of forceps. Okay? So now I'm going to add my items. And I'm going to start by adding my cleansing solution first. I can move this hand sanitizer behind me. I don't need it anymore. And remember, I cannot take my eyes off of my sterile field, so I'm not turning my head, I'm just moving these items behind me. So I'm going to add my cleansing solution next. I'm going to reach for it, and I'm going to reach away from my tray so that I'm never ever risking dropping or exposing my tray to anything that could fall into it. I'm checking the label for making sure I have the right solution. The expiry date is good. This bottle has been opened before, so I'm going to have to lip my neck. So I'm going to take the cover off. I'm tilting the bottle so that the fluid comes to the neck. I'm just making a twist with my wrist. And that's how you clean anything that might be near the neck. I'm going to advance towards my bowl. I'm holding it up high enough that nothing touches the blue drapes, but I also don't want to splash. And I'm just going to cover the cotton balls, just enough to saturate them. You don't have to go crazy. And our disposable catheter insertion sets, often the cleansing solution's already in the kit. Next I'm going to add my sterile water. Again, I'm going to reach away from my tray. I'm checking the label and the expiry date. It's been opened before because I can see where the nurse before me initialed and dated, the same as the cleansing solution. I'm moving the label to my palm so that I don't drip and mar the label. And I'm going to take the cover off, and I'm holding it. There's no need to set this cover down. Just hold on to it, keep it up, don't let anything contaminate it, and advance to, oh sorry, I'm going to clean the neck first. I'm going to tilt my bottle so that the fluid comes towards the neck, and then as it does, just flick my wrist. And I'm just cleaning that neck. Now I'm going to advance towards my bowl, and just fill about 10 mils of water in there. Put the cover on. And reach behind me without turning my back. Okay. Next, I'm going to add my 10 mil syringe that I need to fill and connect to my catheter. And again, in the disposable catheter trays, the 10 mil syringe is already in there with your 10 mils of sterile water, and all you need to do is connect it to your catheter, but there are different types of catheter trays. I'm going to show you the easiest way to hang on to this slippery little syringe, and that's by peeling down the edges like I've shown you in other demonstrations. Pick up your tool, get a nice strong hold on that syringe, take it out of the package. You'll notice I'm standing away from my sterile tray. I would rather drop this whole thing on the floor and have somebody get me a new syringe than to drop the whole thing in that tray and contaminate the entire tray and have to start over. This 10 mil syringe can go anywhere you want. It doesn't matter. It can go into the emesis basin. I'm just going to drop it there for right now, no problem. Drop my garbage in there. Next thing I'm going to add is the catheter, and that's probably one of the, just because it's the longest, one of the little harder things to add to your sterile feel because it's kind of springy. So on the outside of the package, it'll tell you that this is a 14 French, and it'll tell you that it has a, it's coated with a lubricant. And when you look at the inside, it has another blue little package in there. I want you to use the same technique. I want you to peel it down. I want you to peel it down so you can see those two lumens right there. I want you to take your tool and reach and get a good hold of them. Squeeze and pull up nice and high. Don't let it fall below the table. And then I want you to come towards your tray, and because this is all sterile, lay that down horizontally across your tray, just like that. It's garbage. And so we can double check our tray and make sure we've added all of the items that we need to add to do our procedure. And we have, everything is here, we're good to go. We need to do setup next of our catheter and our syringe and our muco and so on. So now we need to apply our sterile gloves, because one of the principles, or the very first principle of sterile technique, is that only sterile can touch sterile. So in order for us to be able to play in here, we need to put on our sterile gloves. Okay? So I can move to the end of my bedside table. I have my sterile tray in view, and my patient is in view, and I'm going to apply my sterile gloves. And in some of the disposable catheter trays, even the gloves are in them. So I'm going to fold back the edges, and I'm going to reach my fingers inside that little flap, and I'm going to pull open my package and give a little tug. And where I'm hanging on represents that 1 inch or 2.5 centimeter unsterile border. I can touch there. Okay. I can see my two gloves sitting up, right and left. I'm a dominant right-handed person. I'm going to apply my right glove first. I'm going to pick up the cuff at the bottom of my right glove. I'm going to hold it above the package. I'm going to tuck in my hand, and I'm just going to start sliding it in. And as my thumb finds its home, I'm going to turn my hand up and just be gentle. I want that cuff to stay right there at the knuckle line. Okay? Now sterile can touch sterile. So this unsterile hand can't touch this glove. I'm going to reach my hand over here and hold on to the unsterile border on my package. My sterile fingers are going to reach down and loosen that cuff enough that I can get all 4 fingers under that cuff. And I don't let the glove come into that outside unsterile border. And I reach my fingers in and pick it up off the package. Okay, and I'm going to just move my fingers enough to make it open. And I'm going to tuck my left hand in, but this time I'm going to be really careful to make sure my right sterile thumb, right here that's already gloved, is going to be abducted away, because I don't want it to run down my wrist and contaminate my glove when I'm putting on my left glove. So I'm going to reach my hand in, I'm going to abduct my thumb, I'm turning my hand up towards the ceiling as I find the home for all my thumb and all my fingers. My dominant hand right here is just stationary and pulling down. My left hand is making a wave towards the ceiling. And then just gently let go. Don't touch that anymore. And now I'm going to fix this glove. So this sterile hand can reach under this sterile glove. And again, point it up to the ceiling. I'm abducting my left thumb now to make sure it doesn't run down my arm. And I'm just pulling down and making that wave. And then put your hands together for a moment and just regroup, rethink about what you're going to be doing, and remember that nothing can touch these sterile gloves. So keep them in front of you. Don't touch that paper. It's not hurting anything. If you've set yourself up the way that I've shown you, you won't have to worry about that package at all. It won't be in your way. And so now we're ready to start putting our stuff together. So the first thing that I'm going to do is fill my 10 ml syringe. You can set up whatever way you want as long as you remember to set up. Don't leave it until you've created your second sterile field. Just set this up first. So I'm going to fill my syringe with 10 ml of water. And I'm going to leave it sit right there. It's not hurting anything. Then I'm going to pick up my catheter. And it's quite springy. You have to be careful. And there's a little perforated line you can see as you start to touch this package. And I'm going to just open that perforated line. and expose those 2 lumens. Okay, so it's quite springy. You can see it wants to bounce all around the place. So I'm going to use my left hand and I'm going to get a good grip on those 2 lumens right now. This green one is the one the syringe is going to attach to, and this other open one is the one the urine is going to flow out of. Okay, so I'm going to get a hold of them and I'm just going to start coiling it up in my hand. As I'm pulling it, it slides right out of that blue sterile package. Okay, I'm going to have it coiled up in my hand. This blue package, it's sterile, it's not hurting anything. Just drop it anywhere you want. It's not hurting anything. And now I've got a good hold on these lumens. See how my thumb and my index finger are holding onto it? I'm going to grab my syringe and I'm going to push that syringe on. So just try that when you do your own demonstration. Just push that on and off so you can feel that tension. That syringe is going to fill the balloon at the end of this catheter when we're all done inserting it all the way. And so then we have to remove this syringe when we're done inflating the balloon. So we'll get to that in a second. So next I'm going to let it unravel. I'm just going to hang on tight to it. And I'm going to let it fall into the large emesis basin, the one to the far left, the biggest one. Let it fall into the basin and it'll come coil back, and then let your syringe, you want it to not bounce around on you. Okay, so play with that until you have it the way you want it. Don't let it bounce out on you. There you go. It's set up for me. And then I'm going to add my muco to the far little corner. So I'm just going to tear. This is all sterile, so it's okay. It can just drop right there. And I'm going to drop that little dollop of muco right into the bottom of the tray, right close to that end of my catheter. Okay, I'm just going to drop that right there. It doesn't matter. So you can see how that catheter laid up into the basin. Let it roll in and fold back, and make sure it's all secured in there and can't bounce around on you, but away from the muco until you're ready to dip it in and insert it. And then I'm going to grab my forceps and I'm going to put that in the bowl. Those are the 2 things that I'm going to need besides my drapes. So now I'm ready to set up move my sterile field. So here's my sterile field right now, my first one. My second sterile field, the one I need to insert my catheter, I have to move over here. I do that with these drapes. So the first drape I pick up is a solid drape. It's just all a solid towel. So I'm going to open it up above my tray. I'm reaching my hands underneath and I'm protecting my sterile gloves. I'm coming in front of the genitalia, and you can use your foot to push the tray out of the way if it feels like it's in your way and you want to move it. And I'm coming in front of the genitalia a fair bit with this paper drape. And I'm just flicking it out. So there would be normally thighs on each side of me. I'm making sure my sterile gloves aren't touching that. And so if you look again at this sterile field and what I've told you about the principles, there is a sterile, a 2.5 or 1 inch unsterile border all along the outside of this drape. So I can touch in there. That's sterile. Sterile can touch sterile. But I don't want to get near this unsterile border. So now I'm ready to put my next drape, which is the fenestrated. It's got a hole in it so that we can narrow in on the area that we're focusing on. So I'm opening that up over my sterile tray, and again my hands are coming up near the top and I'm protecting my sterile gloves, and I'm going to advance now above the patient's genitalia, and I'm going to start laying that drape down. I'm going to look through that hole and I'm going to get it over the patient's genitalia, and I'm going to flick that out. Again, I have a 1 inch unsterile border, and I'm going to just pull that to suit me. And I've created this great big sterile field again for me to move my items down. So I'm ready to insert my catheter now. I'm going to grab I'm keeping my hands very much in front of me. I want to know where they are all the time. I'm going to grab my bowl with my cotton balls and my sterile solution and my forceps, and I'm going to put that right in front of the genitalia, okay, because that's the first thing I'm going to do is cleanse the genitalia. Then I'm going to bring in my large emesis basin with my catheter already set up, and I'm going to bring that in right in behind there. You can note that I am making sure that I am keeping everything well within my sterile field. So I'm going to now lock my hand, and it has to stay there. So I'm going to grab the penis by the shaft, and I'm going to lift up towards the ceiling because that really eases the insertion of the catheter. And I'm going to just cleanse it first. So my hand has to stay right here. And so for a male, it's 3 cotton balls. And so we're going to start right at the tip, the meatus, right in the center, apply some pressure, and then a circular motion all the way down to the bottom of the glands. One movement. Keep your forceps pointed down. Keep your arm nice and high above your garbage and drop that in. We're going to do the same thing again. Start right in the center, apply pressure, and in a circular motion. We never go back over that area, all the way down the glands. And one more, right in the center and all the way down the glands. Drop that in. And we're done with that. We can pick up the bowl and move that right out of our way. And now we're going to insert our catheter. And so for a male, we're going to insert 17 to 22.5 centimeters until we see urine, because it's a much longer path all the way up to the male's bladder. And then we're going to insert, once we see urine, all the way to the bifurcation. So I'm going to pick up my end, and I'm going to tell Jesse to bear down as though he were having a bowel movement. And I'm going to point the penis all the way to the ceiling because that really eases the insertion. And I'm going to keep my sterile fingers back from that muco and back from the genitalia. I never want to touch the genitalia. That would contaminate my gloves. And I'm going to just start to insert. And so I push down a little, move my fingers back. Push down a little, move my fingers back, and so on until I get to about 17 to 20 centimeters. And I'm going to see urine. The catheter is going to, the syringe is going to want to bounce around a little bit. I'm still within my sterile field, and by now I have urine, so I'm going to insert it all the way to the bifurcation. I'm going to just get this back in here so that the urine is all the way to the bifurcation. And there we go. So now that I have it here and there's urine flowing out of there, my left fingers are going to come around and anchor that catheter in place because it really tries to push its way out in a real situation. So I'm going to secure it there. I'm going to reach down and grab my syringe, and now I've got to inflate that balloon, and I'll show you what that looks like at the end of the procedure. I'm pointing the catheter down so that the urine can continue to empty into the emesis basin, and I'm going to inflate my balloon. So it takes a fair bit of pressure to inflate that balloon, and then you've got to keep your thumb on it or it will just release on you. Once I have my thumb down and all of the sterile water inflating the balloon in, I'm going to let go and just hang on with my thumb and index finger with my left hand on the catheter, and I'm going to pull out because I want to see that the inflated balloon is caught in the neck of the bladder and is secured there and isn't going to fall out. And when I see that, I'm great. I'm just holding my thumb on the syringe. I'm bringing my fingers up. I'm pointing that catheter down because I'm going to connect the tubing to this sterile end so nothing can touch that. And I'm going to reach my thumb and my index finger up and pull that syringe off. And now I'm going to grab my tubing. I'm going to reach my tubing under my hand to grab the cap off it with my pinky, come up and marry those two ends together. Get that on nice and snug. Move that out of the way. According to agency policy, you're going to allow the bladder to drain completely before you connect that. And I'm going to, I have a couple of pieces of tape here already And I would secure the catheter, not the tubing, the catheter, to the patient's thigh. And then I can tear that fenestrated drape. I'm going to get some soap and water, and I'm going to help clean up my patient and make sure I've cleaned all of that cleansing solution, make sure that there's no wetness there. I would have also added a disposable pad under my patient's hips as well, which I missed this time in this video, but I would have put that there. And I would return my patient to a comfortable position, make sure the call bell was handy, and I would have cleaned up all of my equipment. I would have removed my gloves. Hand hygiene, you always perform hand hygiene before and after using gloves. And then I would want to document everything that I did. So starting with the size of the catheter, the type of catheter, the amount of sterile water that I inserted into the balloon, how much urine the patient had in their bladder, how the patient tolerated the procedure, all the characteristics of the urine, and I would initiate an in and out sheet to monitor and keep track of that my patient is outputting enough urine and inputting enough fluid as well, depending on the nature of your patient's care. And I think that's everything, and I just wanted to show you when that procedure is done. Again, I want to show you that when I tell you to pull out on the catheter to make sure that the balloon has caught in the neck, this is what we want to see. So that's what 10 mils of sterile water look like, and when we snug that or pull on it, tug, we want it to catch in the neck, the bladder. That's how we know it's secured up there and it's safe in the bladder. And you can see how important it would be for the nurse to document that there was 10 mils of urine in there, because if another nurse came along and didn't know that, or didn't know there was 10 and maybe only took out 5, you can imagine how much damage and pain that would cause our patient if we tried to pull that catheter out with the balloon inflated. And I think that's everything. Thank you.